Really excited. We're presenting 7 late-breaking abstracts here at the ADA conference, and they really expand on our understanding of how the Freestyle Libre system has been adopted and used and what some of the benefits are to patients. So first, we've done a meta-analysis of the use of Freestyle Libre and the effect on HbA1c. And so that looked at 17 studies that have been published, and there was a really strong finding that those using Freestyle Libre had on average a 0.5% decrease in A1C. So that's really supporting what's been observed in different settings. For example, we had a type 2 diabetes patient population where that benefit was shown in those under 65 years of age. So that's been a key finding that's really supported its outcomes. The other big topic obviously is cost, and so that's always been a big focus for the development of the system and for Abbott in general, of really making the device affordable and accessible and easy to use. And so from a cost perspective, there's been analysis on the relative cost savings, in fact, for testing at recommended rates, for example, ADA between 6 and 10 times per day versus using a Freestyle Libre to do that glucose checking. And it's showing there could be savings on the order of $120 to $290 per month using that. So that's been I think a good statement of the value of the system. And then one area of big focus for the use of CGM historically has always been the use in younger adults and even pediatrics, and the benefit in that age and whether they're adopting the system and getting the use and the benefit out of it. And so there's a poster summarizing and really looking at that in particular from 2 of our studies. One, the IMPACT trial that was in an adult population, but we focused on the subgroup below 25 years of age and showed that they continued to have benefit in terms of improved time in range and reduced hypoglycemia. And that was also shown in a second study, the SELFIE study, that was for adolescents, and so that also reinforced that benefit. So that's been a big theme. And then finally, the last big theme has been demonstrating the use of the system in the real world. So a year ago, we showed an initial cut of the data of about 55,000 readers, and we're showing here data from 237,000 readers from around the world from people who are using the system at home. And it's just been consistent with the findings of that people are using the device a lot, they're scanning a lot. On average, they're checking the glucose 13 times per day. And then that those who are checking more are having more time in range, less time in hypoglycemia, less time in hyperglycemia. So it's been a really consistent but really good to see in this expanded data set.